An ortho-OP means an OP for pain. Patients come with different types of pains in ortho-OP. The most important of which is shoulder pain. Today we have Dr. Biju Jacob Abraham, specialist orthopedic surgeon, Ahalia Hospital Mussafah, to discuss about why is shoulder pain increasing in today's society.
That's a very relevant question because yes, we do see a lot of shoulder problems now. There are some reasons for it. One of it is lack of exercise, a poor lifestyle, and a lot of stress and tension. Now you may wonder why we talk about shoulder pain being caused because of this kind of tension and poor lifestyle. Now, I'll come to that in a minute. The other reason is we do much more of what we call as weekend warriors. Like we spend a lot of time with stressful occupations and jobs, and then on the weekend you just want to relax and play just like you did in olden days. So you go and you sort of play as you did in the older time, but this time your muscles are not worked up, you do not have any warm-up, and you get injuries. The third reason is we are getting much older. And the fourth reason that we see most commonly is that diseases like diabetes, which was not so severe before, is now much more common in lower grades and higher grades. So for all these reasons, we see a lot of shoulder problems now. The other reason is sometimes you can get referred pains from surrounding joints like the neck and other places. This can also reflect as problems in the shoulder. Now I've got several patients who have been going from pillar to post, several hospitals, and they end up with you because the problem actually was not in the shoulder but somewhere else, but was reflecting in the shoulder. So for all these reasons, yes, we see a lot more shoulder problems. Now coming to basically the spectrum of shoulder problems that we see, I would say that about 80 to 90% of shoulder problems are actually not resulting in surgery. The treatment can be done in a very easy way, in a very effective way with lasting results, provided there is actually time invested and a little bit of protocol-based diagnosis and treatment for shoulder problems. For example, if I have a shoulder patient who has come to me, it's very important that I take a good history. How exactly did the problem start? When did it start? Did it follow an injury? Did it start all by itself? Do certain movements cause it? Does something relieve it? All these things are extremely important. For example, now if a patient says that I've got shoulder pain every morning, daily in the morning, but not at other times, you need to think of arthritis, you need to think of uric acid, which is very, very common, especially in the Gulf areas. Now, if you say that 4 years ago, 5 years ago, I did play shuttle, and then while I was smashing, suddenly there was a pain, severe pain in my shoulder, then after that it was okay. I did not have any problem, and only thing is that I'm always worried when I do overhead shots. That is a significant problem because it could reflect what is called a slap tear. This requires pure keyhole surgery with lasting results. Otherwise, it can end up as a big problem. So it's very important actually to identify what exactly is the problem and to treat it accordingly. Now, like I earlier said, about 80 to 90% of problems can easily be managed with today's whatever investigations because we have everything in Ahalia Hospital Mussafah, or with good physiotherapy because we have an excellent physiotherapy department which is tailored towards patient-centered treatment. Now coming to most often, why do patients have shoulder problem and they do not get relief? This is because very often patients, as well as several times, many situations result in just an X-ray and painkillers and so on. That is not going to treat anything. You know very well that, for example, if the cause is a muscle pain, this is not going to be reflected in an X-ray. And again, if you take a painkiller, the problem is only going to get solved during the brief time that the painkiller acts, and painkillers have got side effects. So it's very important that we identify, for example, if a patient has got muscle as the cause, poor muscles as the cause of pain, there are many things that a clinician has to look at. Why is the muscle not strong? Now this could be as simple as poor dietary control, not a nutritional diet, not taking food in time, irregular habits. It could be also that there are fad diets. Now we'll not discuss more about this, but actually taking food in the regular time is very important for muscle strength. The second is to keep muscles in good strength and tone, for which we need adequate exercises in a very systematic manner, not just once in a week, twice in a week and so on. Then there are many underlying causes like thyroid, like diabetes, which have to be identified, vitamin deficiencies and so on. So all these put together, if we can identify the cause, we can certainly treat it well, and I'm sure that patients can really have a very enjoyable lifestyle based on the problem that we have. As far as Ahalia Hospital Mussafah is concerned, we do keyhole surgeries, joint replacements, we do alignment osteotomies. Every surgery that is that is possible is available here. The only question is to identify exactly the problem and to treat whether operative or non-operative. Thank you very much.